talk about helmets in babies. Now, are they recommended? Are they not? So what happens is in a newborn, their heads are still very soft and their skull is still forming. And so oftentimes when they're laying on a certain part of their head, for example, the back of their head or a certain side that they prefer more, oftentimes it becomes more flat. And sometimes it becomes noticeable. Usually I first recommend to change your position often as you can. And then try to increase tummy time, which is where you put them on their stomach, to lessen the time that they're on the back of their head, or try to increase the time that if they're old enough, that they're sitting or just in a different position. Now I usually give that a little bit of time, and if that doesn't work, then the next step is sometimes I do refer for a helmet. Now, do I recommend a helmet? I would say yes, but only rarely. And the reason is because there was a study that showed that helmets actually were not more effective than just letting the head naturally reshape. I don't often refer for helmets, but I do for a couple of reasons. One, if the head shape if it's pretty obvious and the flattening is severe, then sometimes I do ask the parents if they would like to try the helmet. The second reason is if the parents are really concerned and they insist on trying one, then I'll refer them, because I want them to feel like they're doing something for their child that could be effective. And I'm sure that helmets are sometimes effective. And also there aren't really serious side effects from the helmets. The most commonly reported ones are some discomfort, some pressure sores on the head, and then some parents report not being able to cuddle with their baby as much because of it. So in general, do I recommend helmets for babies? Usually not, but I do in rare cases refer.